The risk would like some recommendations on derealization. The risk has terrible anxiety, and it's getting worse and hard to deal with. So, what are some things we can do for treatment of? I was going to say, if we're just talking about general anxiety.
Well, derealization is a real thing. That's kind of a different thing. That's where people feel like their surroundings are not real,
mm-hmm.
and that takes some. It's a DSM-5 diagnosis.
Mm-hmm.
It's called depersonalization disorder, and it's kind of a recurring sense that your surroundings are not real, and because of that, because the intellectual part of your brain knows that it is,
mm-hmm.
and then the more you read about things like quantum physics saying that the universe is not local, so it may not be real,
mm-hmm.
It makes things worse.
Mm-hmm.
So, it requires, therapy, talk therapy, and a combination of certain medications. And it might be antidepressants. This person could be a candidate for what Mel B likes is the Trip app.
Yes.
I wonder if that would make it worse, though, because you're being taken into a virtual world with the Trip app. It's a virtual reality meditation app, but it may also center them too. I don't know. I hesitate to just recommend it without them talking to their therapist about it.
Mm-hmm.
But, I also wonder if, in the future when we have true psychedelic therapy, if that would make it better or worse, because you can give people enough psychedelics so that they actually feel that they're outside their body. And you can say, this is what it really feels like to be, for things to be unreal.
Just to show you what really would happen.
And when they come back, maybe they would be, I would be really interested in seeing studies on that.
Well, just to talk about that for a real quick second, what they talk about the psychedelic therapies and the microdosing, it helps to kind of reset your brain.
Yeah.
And I think those are things, and they will do interventional stuff like the stellate ganglion blocks for some people with the serious anxiety disorders.
Yeah.
Talk
about that.
It might be
talk
beneficial.
About stellate.
Yeah. There's a little nerve bundle that's in your neck. It's just above your first rib. It's near your carotid artery that, someone that's really trained with and has a fluoroscopy or ultrasound can go in and identify where your carotid artery is. And this little bundle of nerves right above your first rib and can inject a little numbing agent right into the or right above the nerve bundle, and it can help to calm anxiety and reset the communication between the body and the brain. And they use it a lot in the military. And they've had some success with that too. So outside of the normal stuff, you'll hear people talking about exercising and
it's crazy
diet
this
changes
little bundle
and stuff.
Of nerves, just numbing it up, the benefits that can have. But they've been doing it for like 100 years. Yeah. They use, as Dr. Scott said, ultrasound to find it.
Just make sure they hit the right spot.
Well, yeah, but for 50, 75 years before that. Yeah. And why they thought that this would work.
So that's the funny part.
They were just doing it by you just stick your finger on the person's neck and inject it. But they use it for PTSD, long COVID, chronic fatigue syndrome, also called myalgic encephalitis. And, it's good for head and neck pain too.
Yeah, sure.
I would love to learn how to do this because this is right up our alley. It'd be something like this. Mel B and I are in the same specialty. So, I would love to be able to do that.